Thank you for joining our Medical Life session by Medcare Hospitals. We will be happy to answer your questions, so please send them over on the live chat and comments. Today's topic is pediatric ENT problems. Being a mother of two, already I know it's a huge problem for everyone, and it doesn't have to be related to any season. It could be summer, winter, spring, autumn, any time. So we didn't find a better time like today because we are approaching a long holiday, and I know most of you are going either to the pool, beach, or even staying at home. It's the time where our kids starts, itching and getting sore throat and issues with the ENT. So yes, we are here. I would like to welcome Dr. Nikita Malhotra. Dr. Nikita is interested in ENT pediatric, specialist ENT in Medcare hospitals, a fellowship in functional endoscopic sinus surgery from Singapore, and fellowship in otology from Switzerland. She'll be more than happy to answer your questions. And to open up the platform, we will start with online classes and how it's impacted our kids' health.
Hi, Dalia.
Hello.
It's wonderful to be here. So the all-important topic of online classes. A lot of parents ask me this question. So the most important thing is, how do you choose the right medium for your child to learn? Ideally, it's always good to have external speakers over headphones or earphones. The only reason being headphones and earphones augment the sound to up to 40 to 70 decibels. So your child is actually hearing more than what is the actual sound. Now, if you've got your child inserting a earphone inside, there's no way to monitor how loud he would hear. So you have to remember the 60-60 rule, which is important for every parent, where your child uses his headphones or earphones at 60% of the maximum volume for a period of only 60 minutes. This is very, very important. And also, after 60 minutes of usage of earphones or headphones, they must get a 15-minute gap between the next class. And I think even the educators must keep this in mind. Also, wearing earphones could lead to ear infections if they're not cleaned properly, especially bacterial infections, fungal infections. They could push the wax deep inside. So all this is very important. But I think the most pressing problem is hearing loss. Because when you hear a loud sound, these vibrations are transmitted to the eardrum, and then they go to the bones of the middle ear. And these then get transmitted into the hair cells of the cochlea. If the sound is too loud, your child could land up with a temporary or permanent hearing loss. So if you feel your child is restless, has a buzzing, ringing sound in the ears, or is speaking very loudly, or says his ear is blocked, it's always advisable to meet your ENT and get his hearing tested.
So these are the indicators that once we see them, we have to go to the ENT doctor
immediately. Buzzing sound, irritability with the ears, or block sensation in the ears, or the child is speaking too loud or has the TV volume really up.
Doctor, when they come to you with this problem, what's the next step? What do you advise?
So basically, whenever a child comes to us with this problem, we first examine the child to make sure the eardrum's okay. And then we send the child for what we call a hearing test, which is, in medical terms, an audiogram. Now, like I talked to you earlier, Dalia, there's two kinds of hearing loss. One which could be nerve-related, which could be due to damage produced by loud sounds. The other one could be, which we discussed, called glue ear, where you could have a child who's having lack of concentration in school, or is withdrawing from his peers, not paying attention, becomes a bit of a recluse, or speaks very loudly, has the TV volume on very loud. So you have to differentiate what kind of hearing loss it is. The most common problem we see in ENT practice is glue ear, which means a fluid collection behind the eardrum. So if you have any child coming to us with hearing issues, we have to do two important tests. One is a middle ear pressure test to see if there's fluid in the middle ear, and the other one is to see if the nerve of hearing is normal.
And is there a certain age, or it could be any time?
So this condition called glue ear or serous otitis media is usually seen in children between 1 and 6 commonly, but it can occur in any age group, even adults. And if we do find a child coming with fluid in the middle ear, which is detected on a hearing test, we have to do an X-ray in children to see if the child's got something called large adenoids behind the nose. Because as you know, the back of the nose is connected to the ear by a tube called the eustachian tube. Now, if you've got a mass behind the nose called adenoids, it's not a dangerous mass, it's just a gland of lymphoid tissue. This could block this tube and give rise to a collection of fluid in the middle ear. So we have to rule out enlarged adenoids in these children. So any issue with hearing, may it be lack of concentration, not performing well in studies, not interacting well with peers, buzzing sound, ringing sound in the ears, or just complaining of blocked sensation in the ears, I think it's very important to see your ENT and rule out any of these problems.
Perfect. Doctor, we received a question around snoring. Kids who snores not only during sleep but awake.
Okay.
What is it?
So basically, snoring means snoring is caused by vibration of tissues in the throat, and it could be obstructive in nature. So there's two kinds of snoring. One is simple snoring, which could be even because of obesity, or it could be, laxity of tissues, which is more seen in adults. But in children, snoring is primarily because of, like we discussed, large adenoids behind the nose, which are blocking the nasal airway at the back, or large tonsils in the throat, which have grown so large that they've blocked what we call the oropharyngeal airway, which is the airway in the throat. A combination of these can give you simple snoring, but if your child is waking up several times at night, gasping for breath, is sleepy in the daytime with lack of concentration, then you should look for something called sleep apnea. That means
What's sleep apnea?
So sleep apnea means there's lack of oxygenation because of these structures blocking. So because of low oxygen, the brain sends a signal to the body to wake up, gasp for breath, and go back to sleep. So several episodes like these episodes of waking up are called apnea. And multiple episodes like these, you categorize this into a condition called sleep apnea, and it is common in children. So please don't take snoring lightly. Rule out whether it's just simple snoring due to adenoids or large tonsils, or a blockage in the nose, like allergic rhinitis, which is very common in Dubai, or is it something more serious which is leading to low oxygen and thereby, which could have repercussions later.
Doctor, we usually use, the first thing that we use as medicine is the nasal spray.
Yes. That's a very important
Tell me about the nasal spray, because it's everywhere.
I think we have the highest number of Otrivine addicts in Dubai because we live in the AC and we are exposed to dust, micro dust particles, and we have variations of temperature, humidity going in and out of the AC. I see a lot of patients with allergic rhinitis. Now, any patient with a blocked nose, any person with a blocked nose, for example, the first thing you reach out to is a nasal spray. I would like to advise everyone, Otrivine, Xylocomod, Naziven, Vibrocil, these are not good for you unless prescribed by your doctor, and not to be used for more than 5 days. If you use it for more than 5 days, you have something called rebound swelling in your nose, rebound congestion. To combat this congestion, you'll end up using more Otrivine. So it becomes a vicious cycle basically. So if you do have a blocked nose, see your doctor, see an ENT. They will advise you which spray is best suited for your needs.
Do they affect the sinus?
If you mean long-term use of sprays? If you use sprays long-term, they give rise to nasal swelling.
Yeah.
And nasal swelling could give rise to blockage of the sinus openings, but not per se.
Okay. We got another question. Should I proactively take my children to an ENT for a checkup? If yes, can you explain the process of the checkup?
So I get a lot of patients who bring a lot of parents who bring their children for checkups because they're concerned about their hearing. We get a lot of kids coming with wax because parents are aggressively using cotton buds in the ears.
Yeah, that would be my next point actually, my next question about earbuds and how can we clean the ear.
So a word of caution, cotton buds are to be used only here in the external ear, but not to be inserted into the ear canal. If you insert cotton buds into the ear canal, what you're doing is you're pushing the wax deeper inside. So when you push the wax deeper inside, there's no way to bring it out unless you go to a doctor. This could lead to long-term pressure effects in the ear, and the wax could swell up. It could give rise to infections if there's water in the ear. I have a lot of patients putting olive oil in the ears. Please, olive oil is only for culinary use, not for medical use. Yeah. So cotton buds definitely not to be used. Also, when the parents come, they'd like to see if the child's got any, get a lot of kids with blocked noses. So again, to reiterate, blocked nose could be because of allergies, enlarged adenoids. So all this needs to be ruled out to see if they harbor bacteria. So, that basically comprises an ENT checkup: the ears, the blocked nose, and the throat.
And how often can you come to an ENT doctor?
Honestly, you shouldn't be going to an ENT unless you're symptomatic. Yeah. So I wouldn't recommend patients to just go to an ENT unless there is some pressing issue which is bothering the parent or the child.
We have received another question. My youngest son is subject to ear infection, especially when we go to the pool regularly. How can I prevent it? I think it's a common problem with all parents when they take their kids to the swimming pool, especially swimming pool, not the beach.
Yeah, I do get a lot of kids coming in with swimming pool ridden children. Real challenge in our practice: refrain from using cotton buds to wipe, dry out your child's ears, or do not let them have access to cotton buds, because what happens is you take away the protective lining of the ear. The wax which coats the ear is actually a protective lining. So if you do keep using cotton buds and your child gets into a pool, he could land up being prone to bacterial infections. Treating bacterial infections is a little challenging, like I told you, when we are dealing with atypical bacteria. But once the child's in the pool and is on treatment, he should refrain from swimming for a week. And after that, wear some good quality earplugs if he's regularly prone to ear infections.
Doctor, for some children who can't yet express how they feel, they hold their ears and they itch it all the time.
Yes.
What is it? Is it a sign of an infection?
So itching could be a sign of infection, maybe fungal infection. Itching could be a sign of discomfort, especially which I see in infants, where they could have fluid behind the eardrum. It's seen a lot in bottle-fed babies, where the infants are, or even older children actually who are bottle-fed. I'm surprised by how many kids come who are being bottle-fed. They lie down. When you lie down, the milk travels up the eustachian tube and irritates the middle ear.
This is a very good point.
So bottle feeding is an absolute no unless really required. And if you do, you got to prop up the child at a 45 degrees angle, the infant, or let the older child sit up and drink the milk. But never have a child lie down and drink milk, because that could lead to middle ear irritation and consequent fluid formation.
Doctor, during our conversation earlier and now you mentioned tubes. And I feel, being a parent myself, if I go to a doctor and he advises that we have to put tubes, we get scared or freak out. Why?
So basically, let me just tell you...
And when,
let me tell you the genesis of tubes. Basically, if you have fluid in the middle ear, fluid in the middle ear is only created when you've got a blocked tube because of adenoids, bottle feeding, children with cleft palate, children with Down syndrome. If you've got fluid in the middle ear, we first treat the fluid conservatively with medication, antihistamines, decongestants, nasal sprays. But if the child has not responded for more than 3 months, then we exercise our rights to say that you need surgery, because with fluid in the middle ear, you're dealing with a hearing loss averaging around 20 decibels. And you cannot have a hearing loss because speech is directly related to the hearing. So if you're not hearing well, you're not developing good speech, especially seen in younger children. So in 3 months, if we see we've tried a lot of medication and the fluid is not resolving, then we suggest the use of grommets. Grommets are basically silicone tubes. We make an incision on the eardrum along the fibers of the drum, drain the fluid under microscopic vision, and put a little button into the ear, which is called the grommet. This ventilates the middle ear as well as lets the fluid come out. It does sound scary, but it's a very simple procedure, and it is very vital to do this procedure if your ENT advises it, because it actually gets back your hearing. It's instant gratification. You put the tube in and the hearing comes back to normal. A grommet stays in the ear anywhere from 6 months up to 1.5 years, and then it falls out naturally and the eardrum heals naturally.
So it's not a permanent tube?
It's not a permanent tube. It can stay maximum. If it stays beyond 2 years, then we actually take the patient back to the theatre and pull it out under general anesthesia.
And what is a permanent tube? Does it exist?
Yeah, there is something called T-tubes, which are used in children or adults who have frequent fluid formation, people who travel a lot, have eustachian tubal problems and keep developing fluid. So we have something called a T-tube, which is a more permanent tube which lasts and stays longer.
Doctor, you just said traveling.
Yeah.
So again, this is another nightmare for parents when they're traveling with their children. what should they do before traveling and during travel in the plane? I know we haven't seen a plane for some time, but soon.
So if you do have a child who's got a runny nose, blocked nose, upper respiratory, the lining is continuous. So if you do have a blocked tube, when you fly, you're unable to equalize the pressure. It is this pressure differential which is giving your child pain, and that's why the child starts crying. It's similar to diving or when you go on a high altitude. If you cannot equalize, when you're landing, there's decompression basically. So because of lack of equalization, fluid can form, even blood can collect in the middle ear. So there can be a lot of problems if you fly with a runny nose, blocked nose. So always decongest, see a doctor, get good medication to dry up your secretions, unblock your nose.
Doctor, I received a question now saying, is fever usually the first sign of an ENT issue?
Fever is not a sign of only an ENT issue. Fever could be a sign of COVID, the flu, influenza, urinary infections, other medical infections. But in ENT, fever usually manifests when we've got a ear infection, tonsillitis, or a sinusitis.
Okay. For tonsillitis, is there an age to remove it?
More than age, it is the frequency of infections. How frequent is the patient, whether adult or pediatric, getting throat infections? Because tonsils harbor a bacteria called streptococcus. So basically, recurrent infections with strep can lead to repercussions like rheumatic heart disease and rheumatic joint disease. So we also do something called an ASO titer to see if the patient is a carrier of this bacteria.
Is this the test?
There is a test called an ASO titer to see if you're a carrier of streptococcus. But if you're having more than 3 to 4 infections per year, consequently for 2 to 3 years, that's an indication to get out your tonsils. Another indication is if you develop an abscess around your tonsil. Abscess means there's pus collected around one tonsil. If you don't treat it, it can actually rupture and give rise to fatal complications. So any issue with tonsils more than 2 to 3 times a year, you must consider removing your tonsils.
And is there any signs that a mother can spot immediately? Is there like a breath, there's a smell of the breath,
Yes.
it's different?
So basically in tonsillitis, if your child has tonsillitis, he would have fever, difficulty in swallowing, bad breath, maybe glands in the neck. We call them lymph nodes, cervical lymph nodes. So these are all signs to look out for.
Okay.
Yeah.
Another question, discharge from the ear. What is it caused by?
So there's 2 kinds of infections per se. An outer ear infection, which we discussed, either it could be a swimming pool related infection, a fungal infection. An outer ear infection is called otitis externa, which could be accompanied with ear discharge. This we would treat with topical antibiotic ear drops and maybe an oral antibiotic if required. But the one we really worry about is middle ear fluid getting infected. The pressure of this fluid creates a small perforation in the eardrum and the fluid leaks out from the middle ear into the outer ear. This is what we're really concerned about. This is what we need to treat aggressively, because if your child has a perforated eardrum, so please don't take ear discharge lightly. Because if your child's got a perforated eardrum, then we need to by all means treat the child aggressively so that we can heal the perforation in the eardrum.
On the same point of discharge, we again received another question, but this time discharge from the nose. Again, is it a sign of infection?
No. Discharge from the nose could be just allergic rhinitis, where the lining of the nose is sensitive. We have too many patients with sensitive linings here, like I mentioned earlier, AC, heat, humidity, shisha, oud, strong things like that could give rise to irritation of the lining of the nose. So the nose produces thick mucus. If the mucus is colorless or clear, there's nothing to worry about. But if the mucus, the discharge from the nose is yellowish or greenish, that's a sign of infection, which could most likely be sinusitis.
Okay. And the snoring point we mentioned, because this is another question we've been receiving again about the snoring and mourning. There is another question here, the home remedies.
Okay.
Are you pro home remedies or not?
Well, yes. There's a very common question I get asked a lot. A lot of my patients say, should we eat a lot of lemons and oranges when we're sick? I come from the school of thought where I believe that oranges and lemon, great source of vitamin C, but when you've got inflammation in your throat, if you push lemon juice down, it's acidic in nature. It produces more inflammation. So it's good to take a vitamin C supplement, but it's good preventatively to take oranges, lemons, vitamin C, but when you are infected or inflamed, ideally to avoid.
Doctor, we have a question here. I have two sons, 18 months and 7 months old. Most of the time they are itching their ears, especially while sleeping. Their hearing tests were done at the same time of birth and were normal. Can you please tell me what should I do?
Okay, a hearing test done at birth is only to test the inner ear to see if your nerve of hearing is functioning. If your child is 18 months now, it's advisable to come see an ENT because we need to do a middle ear pressure test. A pressure test is not done at birth. Secondly, we might have to take a swab from the ear to see if there's any colonization of bacteria or fungus in the ear. So these two things definitely would be important. So it's ideally better to consult an ENT and just get a thorough evaluation done. Also, I mentioned if you're bottle feeding your baby, lying down, that could also give rise to irritation in the ear. That could be middle ear fluid. So ideally better to get it checked out.
Another question. Does sleep apnea has direct relation to the soft tissues, or what are other factors to the situation?
Yes, sleep apnea means obstruction of the airways. There is obstruction. So if your child is obese and has a double chin, that pushes your child's tongue back. It's also structurally, if you've got a small chin, we call it a mandible. That touching in the midline, we call them kissing tonsils, large adenoids, a deviated septum. There are kids even who would have deviated septums, not only adults. Then we have something called turbinates in the nose, which are bones in the wall of the nose, which can get enlarged because of allergy. All this can contribute to sleep apnea. So if there's any obstructive factors like adenoids and tonsils, first sort them out and then re-evaluate the snoring. If the snoring persists, then a sleep study could be done. But in 90% of children, tackling the adenoids and tonsils should just take care of the problem.
Doctor, another question. My kid always pick their nose, and now there's a sign of blood.
Yes. So the nose is separated into two halves by what we call the nasal septum. Now the nasal septum, the front of the septum, there's a confluence of blood vessels. We call this the Little's area. Now this is what is accessible to fingernail trauma. So if your child is constantly picking the nose, he's actually not picking and he spontaneously bleeds. First of all, children will never pick their noses in front of the parents. Secondly, if a vessel is exposed and compromised, it can bleed anytime. So please keep your children's nails clipped. Counsel them for nose picking. And if bleeding becomes a common problem, see an ENT because then we would prescribe moisturizers. And if the bleeding is uncontrollable, then we do something called cautery. It's just a chemical stick we use to just cauterize, seal the blood vessel so that the bleeding stops.
Okay. Doctor, another question. Masks.
Yeah.
So my kid goes to school wearing mask. And how can we have a break? I'm trying to put it in a way. So the mother is worried about their kids going to school wearing masks 5 days a week for long hours.
So that's where good quality masks come into, you need to get your child to wear a good quality mask. So the mask I'm wearing is a surgical breathable mask, which is good. Or you can get your child a cloth mask. But
a what, sorry?
A cloth mask.
A cloth,
okay.
Yeah.
But if your child's in a crowded environment or an adult is in like a mall or a movie theater, always better to wear a surgical mask over a cloth mask, okay? But unfortunately, in these times, I cannot give advice as to get your mask off because we are not supposed to propagate that. So, sorry, but this is a way of life right now. As you can see, I'm giving an interview with a mask. But yes, I do feel sorry for these children. And maybe when they go to the restroom, they can take a breather from their mask.
But no, some schools now, they allow if they're in open air, especially now they're having their breaks and lunch breaks outdoors. So it's better for them to breathe fresh air without the masks on.
The only good part about wearing a mask, not only are you preventing COVID, but we also have seen a decline in the number of patients we see with upper respiratory infections. So the masks are actually preventing your child from even the seasonal infections right now. Infections.
Tonsillitis, or it can be other infection?
A sore throat can be related, of course, to tonsillitis, but you could have something called pharyngitis, where there's inflammation of the back wall of the throat. If you've got allergic rhinitis with a constant postnasal drip where you always are clearing your throat, you could have irritation of the back wall. this could be painful. You could have acid reflux, which can irritate your throat and it can give you this kind of a sore throat. So these are things to look at. Acid reflux, postnasal drip due to allergy. It could be just an infection of the back wall of the throat, or it could be tonsillitis.
Another question. My child always complain from knee problem, knee pain.
Yeah.
And she said that she was told before that it could be tonsillitis.
Yeah, so I touched on this topic earlier. If your child's constantly fatigued, complaining of knee pain, always good to see an ENT to get his tonsils assessed and to do the test which I mentioned called the ASO titer. Even if the titer is negative and the child is having constant tonsillitis, like more than 2 to 3 attacks a year, ideally it's good to get the tonsils out.
Again, one more question about traveling. It seems that a lot of people are traveling now. They're good to go. What can they do during the plane takeoff and landing?
So, as a person who's just traveled recently, I think what I noticed is everybody has their masks on. It's okay not to wear a shield, but it's all about sanitization. Surfaces you touch, sanitize after. Wear your masks throughout and try not to touch the front of the mask. Always try to adjust your mask from the side. And you could consider changing your mask every couple of hours. Ideally, better to wear disposable masks when you travel. Change your masks every 2-3 hours. Don't touch the front of your mask. And if you do remove your mask, then ideally wear another one. Don't keep it down on any surface. And sanitization is the key. That's it. Sanitize well with a good hand sanitizer. That's about it, yeah. And don't touch your face.
Yeah. Last question I think we have. It's about, again, not picking nose this time, it's the ears.
Okay.
So my child always play in his ears. Again, is this a sign of infection or?
So if the child is constantly scratching his ears, he could have probably eczema in the ears, which is a common condition.
There's also eczema in the ears?
Yeah, you can get eczema in the ears where the child is constantly itchy. Again, you could have fungus in the ears, bacteria in the ears. You could have middle ear discomfort. That is why the child... You must have seen people with bad colds sometimes, when they've got a bad runny nose, blocked nose, or allergies. You'd want to take your tongue and scratch your palate or put your fingers in and just shake your head.
Exactly. Yeah.
So this also could be a sign of a blocked eustachian tube. So again, if your child is constantly handling his ears, bring him to an ENT and let him get checked out.
Okay. So I think we reach out to the end, right? Yes. So thank you so much for joining us, Doctor. It was a pleasure. Actually, I enjoyed our conversation before and after.
Thank you,
It's amazing. Thank you so much. Thank you so much for our participants and your questions. I hope we were able to answer most of them. And see you in our next session. Take care. Wear your mask always. Wear it properly. And take care.
Thank you. Thanks, Dalia.
Thank you so much. It was amazing having you.
Great being here.